communities, and I think we've gained some valuable insights in doing that. My slide's changing for people.
Yeah.
Yeah, okay. So because it's Black History Month, there's kind of three core areas that we want to address: shining the light on issues, celebrating and connecting with communities, and sharing emerging practice and learning. I think this project really encapsulates all three of those. Just an echo. So the structure of what I'll go through today is a bit of background on the project itself, why we're doing it, some confusion among clinicians about both communities, and then I'll go into a bit of a deeper dive on the Romanian and the Roma community and some of the themes from that we got from speaking to them. And then lastly I'll speak about what we're going to do to help them get their children vaccinated and our planned intervention. So just to warn you, there's a picture of a child with measles about to come up if you're a bit squeamish. So measles is a dangerous condition. It's not only miserable for children that get the disease, they get characteristic rash, flu-like symptoms, conjunctivitis, but it can also spread to other areas of the body, for example, the lungs. You can get a severe pneumonia that can be life-threatening, or a meningitis. So that's why we vaccinate against it and want to protect children. In 2018, there was an outbreak of measles in Birmingham. There was 115 cases, 55 patients hospitalised. Luckily, no one died, but it was a very significant outbreak, and not something that we've seen in recent years because of the MMR vaccine. We've also got data to suggest that the first individuals that were infected were from Romanian communities, and indeed that in these communities there's very poor uptake of the MMR vaccine. So in view of this, the Council commissioned an intervention to try and improve MMR uptake in this community. So I'll just kind of go into some brief differences between the two communities, because while the team was scoping the project, they identified that among a lot of clinicians, there was some confusion about the difference between Romanian and Roma. And I don't think they're necessarily alone in that. So this is a kind of a very broad overview. So Romanians are people from the country of Romania, and they have a national, cultural, and ethnic identity. So that's fairly straightforward. But the Roma people, on the other hand, are part of the GRT group, and although they are associated with these other communities, they do tend to have fixed residences in the UK. They also have a distinct ethnic background, so originating from the Indian subcontinent, and they have diverse cultural identities within the Roma group as a whole. Where some of the confusion may lie is that a lot of Roma actually originate from the country of Romania and speak the language. So this could be where some people are confused, but they have suffered intense persecution throughout history and still do today across Europe, and I'll go into that a bit more later. So how do we engage with these communities? It was decided that the best way to do that would be in focus groups, and these are quite informal conversations really with the communities, but we wanted to find out what they know about what they know about measles itself and the MMR vaccine, and then barriers to them taking their children to have the vaccine, and then things that we can do to help them, so enablers. And in order to do that, we work with two brilliant community organisations. So DOOR is a Romanian community organisation for the Romanian diaspora in the UK, and they were helped to facilitate. Also, the Big Issue group were brilliant in helping us to connect with the Roma community, so we're really grateful to these guys. We couldn't have done it without you. So I'll start off by talking about the Romanian community and what we kind of gained from them. So this is a little bit about Romanian culture. I just want to caveat that I'm not an expert on this, and this is from kind of some online research. So if there's any Romanians in the audience that want to correct me on any significant misinformation here, then please do. But so there's a history of multiculturalism in Romania. So for example, in Transylvania, which is one of the central areas, there's influences from Germany, for example. So they have this kind of rich history of multiculturalism in the country. The Romanian Orthodox Church is important to mention. Although today Romania is very much a secular society, contemporary, the church has still persisted through a long period, including a period of communism where religion was restricted. And although it's not as strong as it once was, a lot of people are still part of the church, part of the Eastern Orthodox Christian tradition. This is a picture of the Metropolitan Cathedral in Iași, I think it's pronounced, which is the biggest church in Romania for this religion. Romanian cuisine is also very diverse. So it's got, again, influences from other places, from Turkey, from Greece, from Austria, for example. And this is samole, which is like cabbage parcels of like mincemeat and vegetables and rice, which I think looks quite appetizing. So over the last 10 years, there's been a big increase in the immigration to the UK from Romania. So to give you some numbers, in the 2011 census, there was 80,000 immigrants from Romania. And in the 2021 census, there was over 500,000. So that's more than a five-fold increase. So this is a significant proportion of our population. And also to mention that many of these are young people contributing to the UK workforce and supporting our aging population in the UK. So they're very much contributing to our society in a lot of ways. That being said, over the last couple of years, there's some newer data from the Migration Observatory that suggests that since 2020, when immigration laws became a bit stricter, there has been a significant drop in immigration, but the absolute numbers are still quite high. So as we're shining the light on issues, I wanted to speak about discrimination against Romanians in the UK. So since Brexit, there's been increasing attitudes of xenophobia, and it seems to have become more acceptable to be overtly kind of racist and xenophobic towards immigrants, including Romanians and other people from Eastern Europe, for example. There's also a negative portrayal in the British media. Some newspapers have been accused of calling Romanians invaders, in inverted commas, or being involved in criminality or benefit abuse. So it's not a great picture. It's quite embarrassing, really, for the UK. So coming back to our intervention and what we did with the Romanian community, we found that they were actually very hard to reach. So we were working with the DOOR organisation, as I mentioned before, and they told us that there was an intense stigma in the community around the topic of vaccines. It didn't matter whether you were pro-vaccine or against vaccines, just the topic itself was so stigmatised that many Romanians would not speak to us about it. They didn't want to do that. They didn't want to, in their words, expose themselves to talking about that topic. And DOOR did give us a lot of useful information, and they said that many of these people were young mothers, potentially with newborns, and this is the time when they're potentially most vulnerable and need the most help from their community, and therefore they didn't want to expose themselves to any stigma, and that's fair enough. That being said, we did get some very good kind of second-hand information from DOOR regarding this population that we included in our analysis. So now I'm just going to talk to you a little bit about the barriers that we found in the Romanian community to getting vaccines. So in the end, we did speak directly to about 4 Romanians, and we also got, as I said, this kind of second-hand information. So that's what we used in the analysis. So the first thing we identified was health literacy and education. So most of the Romanians we spoke to were actually highly educated, but they had a feeling that some of the people that were anti-vaccine potentially had a lower educational level, and that was why they were potentially more likely to be afraid of vaccines or to believe kind of conspiracy theories, etc. Most of the Romanians we spoke to were actually pro-vaccine. That being said, the word itself, measles, when we spoke to them, they weren't really sure exactly as to the translation, and I think also to the potential severity of the condition. So the next theme was false information on social media. So this was a big one. Many people in the community get almost all their news and information from sources like TikTok, social, and Facebook, for example. And obviously, these things are unregulated. There are a lot of creators and providers on there that are potentially releasing false information. They also mentioned that people from the Romanian community wouldn't necessarily believe very outlandish kind of sensational conspiracy theories, but they would try and find what seemed to be creditable sources on these outlets and use their kind of pseudo-scientific explanations, kind of false information, to justify their anti-vaccination behaviour. So this contributed a lot to their not wanting to get the vaccine, and this also became a lot more prevalent after the COVID pandemic, and they're kind of synonymizing the COVID vaccine and the MMR vaccine. So the next thing we found was a distrust of healthcare professionals. And interestingly, information we have from the DOOR organization was that many Romanians choose to go back to Romania to have their healthcare. They feel the service they get from the NHS is not very good, the waiting times are too long, and they'd rather have their care in Romania. We also allegedly heard that some healthcare professionals in Romania are actually advising them against getting vaccinations because these were just conditions that their children would get anyway and get better. This was quite shocking information that we found. Also, Romanians kind of didn't see UK health professionals as being in the same kind of social group, and they therefore felt kind of dismissed by them or didn't really trust them. And this was kind of linked with the false information on social media by conspiracy of control. So people felt that the government was trying to control them by, for example, forcing them to get their child vaccinated and excluding their child from school, for example, as a result of that. We know that's not true in the UK, but these kind of conspiracies were believed by some people. Community influence was another really important one. So authority figures in the community are sometimes anti-vaccine, and they kind of disseminate this information down, and then other members of the community then behave in a certain way. Religion, as I mentioned before, the Romanian Orthodox Church, many people are still religious, and some religious leaders may also be anti-vaccine, and this again gets disseminated. There's also a common refrain that it's God's will if he wants to protect my child or not, and it's not for us to kind of meddle in these matters. So these were the themes we got from the Romanian community. Just another note that the immunisation schedule in the UK versus Romania is very similar. With regards to MMR, we both have it at 12 months. In the UK, it's 3 years. Romania, 5 years. It also started in Romania in 2004. So some of the mothers we spoke to would probably have had the vaccine themselves. So now I'll go on to talk about the Roma community. So same caveats here. If I've got this wrong, then let me know. So this is just kind of a little snapshot of some of the aspects of the Roman culture. So as I mentioned before, there's a lot of regional diversity. So there's Roman people in a lot of places in Europe, most places in Europe, and the kind of individual groups and communities have their own individual cultures. But they are all united under the Roma flag, which is at the top here. The blue signifies the sky, the green signifies the ground, and there's a 16-spoke wheel in the centre that signifies movement or progress. This was developed in the 1971 World Congress of Roma People, which is the first one they had. So art is also important in Roman culture. This is an image from Robert Zeeby, who is a young Roma artist who tries to take kind of images and traditional artifacts from Roma culture and portray them in a slightly different way that they might not have originally been intended. Music is also really important in the culture, partly because it's an important way to kind of pass on traditions and to really kind of create that cultural identity. But also it's kind of pervasive in a lot of societies. So for example, flamenco dancing, a lot of the rhythms and kind of movements in that comes from Roma culture. So there's elements of Roma in a lot of places you might not expect. There's also the Romani Art and Culture Company, which is an organisation which promotes kind of the rights of the GRT community through performing arts and tries to increase competence there. So Roman people's experience is preferable in the UK, according to a recent survey, compared to other areas in Europe. And that is actually quite striking, as you might find on the next slide. So discrimination against Roma is actually very shocking. One example is there was a coercive sterilisation program into 2004 in the Czech Republic and Slovakia. It originally started in then Czechoslovakia in the 1970s. Tens of thousands of women from the Roma community were made infertile systemically by the government, and it only stopped due to international pressure in 2004. There's been no effort to remedy this with the Roma people since. Even in the UK, about half of Roma people have experienced racial assault and about a third physical violence. So if they feel that that is the preferable situation, it's, you know, it worries me as to what else they've experienced in Europe. They've also had a negative portrayal in popular culture in modern day, and historically they're often portrayed as lovers of freedom, but also to be involved in criminality and violence. So I think it's really important to have this in mind when we speak about these communities, because they do have very deep wounds in their history. So again, coming back to our intervention, so these were the barriers that we found in the Roma community. And interestingly, and perhaps surprisingly, we actually got better engagement with the Roma community than we did with the Romanian community, even though initially trying to make contact with Roma was extremely difficult. But once we went through the big issue, they were amazing, and we managed to get 12 people. So the people we spoke to were mainly young mothers in their late 20s and early 30s, and many of whom had more than 10 children. So this gives you an idea of how much experience they potentially have with the childhood vaccinations. So the themes were similar to in the Romanian community, but they had quite different emphasis. So I'll just kind of explain what I mean by that now. So general education levels in the Roma community were lower because a lot of Roma people leave school early, many at primary school age, and this kind of makes them more susceptible to having poor health literacy. And indeed, when we spoke about measles, again, they didn't really know the term, and many thought we were talking about chickenpox, which we know is a much less severe condition that it is kind of okay for children to get, even though there is a vaccine available. We also found a really interesting thing when we spoke to them about this. So through the beginning of the conversation, we spoke about vaccines and vaccination, and many of the mothers were very much against that. I've never vaccinated my child, never in a million years. Towards the end of the conversation, we mentioned immunization, and immediately they were like, yeah, that's fine. That's what the children all have, that's just a standard thing. So something as simple as just changing the terminology was actually kind of transformative in what they thought about it. So again, false information on social media was a big factor. Many Roma people use TikTok primarily for their sources of information. And in slight contrast to the Romanian community, they did seem more willing to believe fairly outlandish conspiracy theories, for example, that AI robots were coming to get them, or that vampires were on the rise, for example. I wasn't sure whether this was actually directly linked to the vaccine, but just the fact that they were kind of susceptible to believing these kind of outlandish things, I think, is also interesting information. There was a massive shift in perception after the COVID-19 pandemic, and I think this is a direct result of false information that was on social media, and also anecdotal evidence from people in the community that they were completely fit, healthy people, and they had the COVID-19 vaccine, and then they dropped dead. So this was a really, really potent kind of influencer to these people, and many of whom said, and remember they've got like 8 or 10 children, that prior to the COVID pandemic, they vaccinated all their children. Post-pandemic, no way, not in a million years. And the key thing here is they're terrified. They think that all they want to do is to protect their children. And from their perspective, the best thing they can do is to avoid the vaccine because they've had all this kind of false information. So that then leads into community influence. So authority figures in the community, whether they're anti-vaccine or not, have a massive influence on other members, and probably even more so than the Romanian community, religion plays a big part. So many Roman people are very religious, and even those who we spoke to who were pro-vaccine spoke of God and praying to God as a reason why they would vaccinate their child, because they see it as a kind of divine intervention of some sort. They also, again, spoke about if it's God's will or it's up to God as to whether their child will be protected. So distrust of healthcare professionals is the final theme again, and I think it's kind of understandable in a lot of ways. We had anecdotal stories of healthcare professionals and just people in the NHS being quite dismissive, being quite unfriendly towards Roma people, and it goes down to that discrimination. Also, as I previously mentioned, Many Roma people are aware of this sterilisation program that's happening in the Czech Republic, and this is an example of where healthcare professionals have genuine malicious intent towards them. So it's kind of understandable that they're not very trusting. Okay, I'm going to try and make it a bit more positive now. So these are some of the enablers that we kind of distilled out from these focus groups to help people from these communities to get their children vaccinated. There's both flags here because we kind of group them together as they were very similar. So again, I've grouped these into the same themes as we had for the barriers. So the first two enablers we found were many people spoke about wanting more information. So they want to know what's in the vaccine. They want to know what happens when their child is injected, the process of immunization. They also spoke about language barrier here, and sometimes maybe consultations are not done in their language, and they don't really understand what's being said. They spoke about having a video, for example, in the GP waiting room that explained the situation and was accessible to non-English speakers. The second enabler we found was the shock factor. So some people said, if I was shown shocking images of these kind of life-threatening and terrible complications of these infections, then I'd be more likely to get my child vaccinated. That being said, there's been a recent systematic review into methods at increasing vaccine uptake, and they found that shock factor or scare tactics are ineffective. So we might need to have another think about that one. So the next one's really simple, just taking the time to talk. And I think this again feeds into kind of the language aspect of it. So many people just felt that they just wanted their fears to be acknowledged. They just wanted to talk through it, to kind of understand each other's perspective, and then they'd be much more likely to get the vaccine. And this is so simple, but I can see why it doesn't happen. I mean, like I've got, first-hand experience of being in a busy clinic, somebody brings in their child with one issue, and then you realise at the end of the consultation that they're not vaccinated. It's not always easy for the clinician to be in the right mindset to have that conversation. But I think if we give them the tools to do it, it's much more likely to be effective. And the last one is kind of more of an inference on my part. No one actually mentioned this in the focus groups, but I think it's clear that if we're able to convince higher ranking or authority figures within the communities, and that could include religious leaders, then surely that message would then get kind of disseminated down to other members of the community. Okay, so the last thing I'll talk about is our intervention that we have planned. So essentially what we want to do is train primary care healthcare professionals or just people that are going to interact with these communities in motivational interviewing. Essentially, motivational interviewing is a technique where you try and change someone's behavior by kind of harnessing their internal motivations. And I'll go into a bit more detail on that. So this looks a little bit complicated, but it's something called the COM-B model, which is quite a common theory in behavioural science, but not everyone might be familiar with it. So on the right-hand side, you've got the behaviour in the blue box, and then that is influenced by capability, motivation, and opportunity. So what does that mean? So capability, they have to be able to do the behaviour. So do they know who to call at their GP practice if they miss their appointment? Do they know how to get there, for example, like that? That's kind of quite a simple one. Motivation, do they want to do the behaviour? They absolutely do not want to do the behaviour. They're absolutely terrified of it. They definitely do not want to vaccinate their child because from their point of view, that would be a more dangerous thing to do than to get the vaccine. So that's something we really need to address. And then finally, opportunity. So that doesn't just mean, do they have a car to get to the GP surgery? That means, do they have the social opportunity to get their child vaccinated? So is there a massive stigma in their community? Do they live in a household with somebody who's incredibly anti-vaccine and they'll be kicked out of the house if they get their child vaccinated? So these are all big issues, but I think some of which we can address. And then finally, the future impact of the project is not only to try and improve vaccine uptake in the Romanian community, also to be a proof of concept to be applied to other minority communities in the area. And we know that there are a lot of other minority communities that have poor vaccine uptake. So hopefully this can have quite far-reaching benefits. So I've spoken about some fairly sensitive and potentially controversial topics, so I would welcome any questions or thoughts from you guys.
Thanks, Andy. Has anybody got any questions that they want to ask? We do appreciate this was quite a quick kind of talk about the engagement work, but just want to put it out there on the floor really if anyone's got any questions, or just general thoughts. They don't have to be questions and any experiences. I know there's quite a range of professionals on the call. Does anybody want to say anything?
Yeah, I'll add to that. Well, I won't add to that, but I will. My name's Shaheen Akhtar, Faith Sector and Inclusion Development Officer, Sandwell Council. I just wanted to say that what a great presentation that was. I've been taking a lot from it. But there was one thing that you mentioned was you said the community was hard to reach. And I think that's such an incorrect term to use because they are physically there. Our GRT communities are there and I work really closely with them in Sandwell. And I think as professionals, that's our barrier. That's something we need to overcome and go to them and educate and raise awareness of what that community is all about and change perceptions within our communities. That's all I would like to add, but it was a great presentation, so thank you.
Do you want to add to that, Andy?
Yeah, I think that's completely right. I think the onus is on us to reach out to them, exactly as you said. We're not, I didn't mean that, that the community is being evasive. I just meant that, from our side, it was difficult, but I completely agree with you that it's up to us to reach out to these people and to try and help them rather than the other way around.
Yeah, totally. I mean, I think we all know that phrase has been around for a while, and we are kind of flipping it on its head and kind of say it's more the services rather than the communities themselves. And we've had a lot of lessons learned from this ourselves because it's the first time we've focused on both of these communities. And we've managed to have some really, really good relationships, which we're hoping we can harness and carry on with. But yeah, that's really, really helpful and a really, really good comment on that, Shaheen. So thank you so much on that. Anything else from anyone? Okay, that's fine. I mean, by all means, please do drop us an email if there's anything that comes through. The next steps really for us is, so Andy's just sent you a feedback, it's QR code, but I'll just post. Yeah, okay. Looks like he's already done it. So posted a feedback form. If you can kindly just complete that. Oh yes, we've got a question from Eleanor.
Hello, just to say what an excellent presentation, really important work. I'm a GP academic at UCL and the Inclusion Health team. I wondered if you could talk a bit more about how you had managed to engage this group and also in so successfully in such a short space of time, and also whether you had plans to publish. Thank you.
Yes, I'll take the last one. Yeah, I'll take the last one. We'll flip it on its head. I'll take the last one. I'll go back to Andy. So we are hoping to publish. This sits within a primary piece of work that we're doing around the intervention that Andy mentioned. But yes, there are plans on publication, publishing. Get my words out. So as soon as we know, we will. We do go out. We're hoping to go out to conferences and do further sessions like this. In the future, it's just capacity at the moment that we're struggling with. But yes, we will definitely, depending on which route you've come through, please just keep an eye out. And I have posted my email address as well, so do drop me a message. And then I'll hand over to Andy for kind of how we got about it, really. So
yeah, so I think there's some guys showing a big issue on the call, but yeah, it was essentially, I mean, Lewis Ellie, my colleague, she did most of the legwork, all of it actually, but essentially, because the big issue worked with a lot of Roma people as they are their vendors for the magazine. So they have really good links with the community, and they've also they're there to help the people of the community. So they're not kind of there to like get something out of it for themselves or promote their business. They actually seem to have genuine kind of beneficent attitudes towards the whole situation. So they managed to set us up. So they basically just said to the community members, we've got this. So we did incentivize £10 voucher for shopping, and we did it at the big issue kind of office. So that's where they come anyway to get their magazines to sell, and it's a place they know, and it's a lot more kind of familiar. So I think that was probably one of the reasons why we were a lot more successful with the Roma than we were with the Romanian, because that was more kind of council-y in the way we kind of went about it. But we definitely learned like really good lessons, I think, from the engagement.
Yeah, definitely. I mean, it did take us about 6 months, yeah, to actually get this data. And as I said, we have had a lot of lessons learned. We were hoping to do this engagement, I think back in June, maybe, top of my head, May, June, and we just could not get we just didn't know who to go to, really. You know, we do have a communities team within our public health, but then it's, you know, finding an organisation who was willing to support us as well. As Andy said, we have incentivised participants for their support as well, which personally I think is really important. You know, I mean, on the flip side, we did have some individuals who said, no, I don't want the voucher, but they were more than happy to give us their views. So it's kind of pros and cons, but I think the incentivisation really helped. I think Andy or Lewis, I think they mentioned one mother mentioned, you know, I think because it was a love shop voucher, she was like, oh, I can get my baby's milk from Boots. And that really helped as well, given the cost of living crisis as well. So although it has taken a good couple of months, but it's worth it. You know, it was very frustrating at the time, like, which way do we go? How do we get these views? But can't thank the organisations, both of the organisations, you know, they've been absolutely smashing. And the data, as you've all seen today, you know, that will definitely help us shape the intervention that we're hoping to do with the professionals. So that intervention won't actually start until the new year. We're just going through all the ethics, and as if anyone's on the call has gone down the ethics route, you can appreciate how difficult that is, and NHS and stuff. So we're hoping in the new year we can kind of implement that, and there will be an external evaluation as part of that work as well. So we're hoping at the end, you know, hopefully this time next year, we'll be able to go out and say, this is what we found, this is the evaluation, and really give us some really, really good insight as a pilot. So thank you, and for that question, it's really, really helpful.